Thank you for joining us tonight for Living Well with MS, Health Awareness and Promotion. This webinar series is brought to you by Can Do Multiple Sclerosis, the National Multiple Sclerosis Society, and the Multiple Sclerosis Society of Canada. My name is Laura Allen, Programs Manager for Can Do MS. I will be your moderator this evening. Can Do MS delivers health and wellness education programs to help families with MS thrive. Please visit the Can Do MS website, cando-ms.org, to learn more about Can Do MS's online and nationwide in-person programs. Can Do MS is excited to partner with the National MS Society for our 2019 webinar series. The mission of the National MS Society is to help people affected by MS live their best lives as they stop MS in its tracks, restore what has been lost, and end MS forever. You can explore other societies' programs, services, resource, and connection opportunities at nationalmssociety.org. Our speakers this evening are Meyer and Lindsay Leikin. Meyer is a rehabilitation psychologist and clinical researcher specializing in multiple sclerosis at the Johns Hopkins University School of Medicine. Her research and clinical focus is the cognitive and emotional symptoms common in MS. Lindsay Leikin is a nurse practitioner and fellowship-trained MS specialist. She works with the neurology group in California, and she is also working at the University of California, Riverside in the Multiple Sclerosis Clinic. In addition, she is also a professor at Azusa Pacific University for the Nurse Practitioner Program. And now, I would like to turn the program over to Lindsay.
Thank you very much, Laura. I feel honored to have been invited to speak to all of you tonight on the topic of wellness, along with Megan and Laura, so thank you very much. Tonight there are three objectives that will be covered. First of all, of course, what does it mean to live well with MS? And we're going to go very much in depth with this question. Also, as with any new year come resolutions, so we set goals, and we hope to facilitate the process of you identifying at least one SMART goal for 2019. Both Megan and I will facilitate this process for you. And also how to get and stay motivated once you've set your goal. Now, I would encourage you for this webinar, if you have the capability of doing this, having a piece of paper and something to write with, just to jot down some notes. If you think of some ideas, it's good to have it written down. If you prefer just having it on the forefront of your mind, that works as well. What I encourage you to do right now is just to kind of reflect on different symptoms that you've been experiencing for the last year, maybe within the last few months. Something has been has come up and has really caused some disability for you. So if we could look at different symptoms of MS, they could be categorized as invisible symptoms or visible symptoms. And this is in terms of what's visible or invisible to the public eye. And these certainly don't include all of the symptoms of MS. There's various others such as headaches, bladder and bowel function, etc. But these are quite a few of them. So different types of invisible symptoms could be mood changes, cognitive change or memory problems, difficulty staying focused, fatigue, anxiety, depression, pain symptoms, paresthesias being numbness or tingling, maybe feeling things as hot when really they're cold, vision changes as well. Some visible symptoms could be gait or the way that you walk, balance, also weakness, tremors or shaking. Ataxia would be coordination difficulty, and also slurred speech could be happening on occasion. So if you have some symptoms that you're concerned about, you can take the time to write them down.
Thanks so much, Lindsay. So we wanted to take this a little bit further by providing an example from somebody who's living with MS. So let's meet Mitch Sturgeon, who writes about his experience with primary progressive MS in his book, Enjoying the Ride, and he also has an online blog. In this particular blog article, Mitch starts by describing some of those symptoms that Lindsay just listed that he experiences on a day-to-day level. He writes, I'm not going to read this entire thing, so I'm going to read the highlighted parts, and hopefully you can read the whole quote later on. But he writes, I can no longer type, I can no longer hold a book. All of my outdoor passions have been taken from me, and my condition is probably going to get worse over time. And yet, he goes on to describe many positive things that are happening in his life as well. He says, I can see and hear and speak. I have a diversity of interests which occupies me all day long. I smile and laugh every day. Here we see that he identifies multiple areas of strength and things that are going well. If we spoke to Mitch in a little bit more detail, he might be able to identify barriers, those things from the last slide that he might want to improve or change upon, or he may identify that those barriers impact him in specific wellness goals that he has for himself. He may identify that he wants to maintain or increase the activities that he enjoys, the activities that are going well. So for all of you out there, reflect on what's going well. What are the strengths that you have that are in your life? They may not be the same as Mitch, but they may be. Try and write down some of these strengths. They might help you identify a wellness goal, or they may help with motivation, and I'll speak about this in a bit more detail as we go through the talk. Notice some of the areas that Mitch comments on. He talks about his mental outlook. He talks about relationships with family and friends. He also talks about engaging with hobbies and interests and his physical health. These are all areas of wellness and all areas from which we can create wellness goals. So Lindsay is going to talk about these wellness goals and describe them in a lot more detail in the following slides.
That's a wonderful point, Megan. It's also good to focus on the positive things that we have going on in our lives and to count those blessings. I love this analogy of wellness and looking at it in the image of a tree with many branches. As you can see with this image, each branch stands for a different dimension of our lives. So just as there's many branches to a tree, there's many dimensions to our lives that ultimately bring us joy. And a combination of health within all of these different areas make us well holistically. So if we look at these different areas, one of them focuses on physical well-being. So that's diet, exercise, and healthy behaviors. Another branch focuses on our emotional well-being. How are we doing emotionally? This could be, if we're overly feeling anxious or depressed, maybe meditation is something on the forefront of our minds of practicing. Spirituality, this goes beyond, are we attending, maybe a church service or praying regularly? This could be, do I feel connected? Do I have a purpose? Cognitive well-being also goes beyond memory. Are we able to stay focused and complete a task that we've started? Also work and home. Maybe you're not working currently and you're unable to work but more at home. How are things going on at home? Are you able to complete your household duties? Has there been some kind of spousal reversal where your spouse is used to having one role in doing certain tasks and now it's had to pick up a lot of extra things to do? And how is that overall? How are they coping with that, and how are you coping as well with the changes? Also, relationships. Is there a support system in your life, your friends, family? Do you feel isolated and supported? So all of these things matter when talking about wellness. Okay, so what is wellness? Maybe you've heard this term thrown around quite a bit, and you may be thinking, well, I've been diagnosed with multiple sclerosis. I'm not well. I have a diagnosis. And it goes much deeper than this, goes much farther than the diagnosis. Wellness, by definition, is an active process through which people become aware of and make choices toward a more successful existence. So this is very individualized. It's hard to categorize what wellness would look like for everyone. But essentially, I think if we're able to focus on our gifts, our talents, how we could bring a purpose within our lives and serve others, possibly would be great to think about in encouraging this process of wellness. Also, it is a dynamic process and ongoing, which is suggested by the word of active the words active process. So if you feel like you haven't been doing such a good job as far as moving towards this process of wellness, this is just a dynamic process that happens throughout our lives. So there are steps that you can make. So in the first question I have here, again, you can write down your answer. You can just keep it in the forefront of your mind. What are some steps you can make today towards your state of wellness that will provide improved quality of life in your future? Maybe you have an idea of that now. And what are some things you can improve your overall health to improve your overall wellness?
So Lindsay just asked you to write down some areas of your life in which you'd like to make a change. I'd like to take it a little bit of a step further, and we're going to refine this down as we go along. But think back to that tree. Think back to those areas of life that you were just jotting down for Lindsay. I want you to write down that area of life in which you would like to make a change, and then write a reason for why that's important to you. It's really important in terms of thinking about goals and motivation to understand the reasons behind wanting to make a change. I had a person who I was working with who was told to quit smoking by their doctor, and that really caused him some angst because it was a decision that was made for him, not a decision that he made for himself. So it's really important that we're making goals that are important to us. And so having good reasons behind those goals is very important. I'd also like you to think a little bit more, as Lindsay talks about different aspects of wellness, the shades of gray that a goal can have. So when you think about setting goals, there's many different kinds of changes that are possible. This slide offers you a range of options from which to choose, and over time you can set many different types of goals. It's not just do something or stop something. You might want to start doing something like I want to be more active. You might want to do less of something like I want to eat less ice cream over the course of a week. It may be that you like what you're doing, but you'd like to do it in a little bit of a different way. So, something like I want to spend time with family, but I'd like our interactions to be more positive. Maybe you have started doing something towards a wellness goal, but you'd like to do more of that. So you meditate once per week, but now you'd like to do it twice per week. So think about goals in shades of grays and not just start or stop something.
Perfect. So this is the wellness tree. We're going to dive in a little bit and talk about the relationship between health and wellness. And I often see that when someone feels and is being their best physically, the other branches of wellness often benefit as well. So we're going to dive a little bit more into physical wellness. So on the left-hand side, this is describing some of the most common comorbid health conditions in MS. So what is meant by comorbid health conditions is other health complications that commonly come along in individuals with multiple sclerosis, according to research data. So some of these different diagnoses are depression, anxiety, which are more psychological conditions, hypertension, diabetes, high cholesterol, and chronic lung disease. They don't really have any relationship with multiple sclerosis. I don't believe multiple sclerosis causes these conditions, but we often see them coincide. These different health conditions are also common to the public that don't have multiple sclerosis. So this very well may be the case. On the right-hand side, this is a great visual just to show that the goal of reaching your optimal health and the interactive play that should occur among your neurologist, your primary care provider, and other specialists to help you achieve this. So you should not just be seeing your neurologist, you should also be seeing your primary care provider regularly for your yearly visits, and any other specialist that you've been referred to. That might be a urologist, a GI specialist, maybe a neuropsychologist, endocrinologist. So it is good to continue, with your usual well visits and make sure you're being cared for by all of your providers. So essentially, there should be this interactive play between you, being the ball, being passed between your neurologist and PCP. And there should be an open communication between the two to make sure you're being cared for in a holistic manner. As far as preventing comorbidities, there are definitely modifiable health behaviors that we can make to reduce the risk. However, some genetics does play into this, and we cannot pick our parents. So unfortunately, if mom and dad had diabetes, you are more at risk of developing diabetes. So that would be just something you'd have to be more aware of, and maybe just being more keen on those modifiable health factors or modifiable health behaviors rather to prevent them. So there's this acronym SNAP, which makes it easy to remember as far as what are those modifiable health behaviors that you can reduce in order to improve your overall lowering the risk of developing any of those comorbid health conditions. So smoking is one behavior that should be eliminated. Poor nutrition, alcohol overuse, and physical inactivity. Support in stopping these factors is highly recommended. Someone to keep you accountable, to motivate you along the way. If you happen to fall back into those old habits, someone to just kind of encourage you that you have done it before and you can do it again. So having someone that you trust, that you know isn't going to, make you feel regretful, but just encourage you to make the appropriate positive changes in your life is someone that is appropriate. Exercise is great if you have multiple sclerosis. 30 minutes of aerobic exercise and some strength training twice a week is just a general recommendation. But of course, modifying what fits in with what you're capable of doing, also what is realistic for whatever else you have going on in your life, something that you're going to be able to stick with, stay compliant with, and is realistic for you, something that you love to do as well. Regular exercise improves lots of different things: strength, mobility, fatigue, depression, cognition, and bowel and bladder function, and other things as well. I often see with my patient population hip flexors being the first muscles to become weak. So making sure you're strengthening those hip flexors. Those are the muscles that allow you to lift your leg up in the first motion of ambulating. Also, you want to be aware of some spasticity, which would be stiffening. If you feel like some muscles just don't stretch very well and or hurt, then make that known to your doctor. Now, I mentioned to modify as needed. Also, stay well hydrated. Take breaks if you need to. That's totally fine. If you feel like you're getting more fatigued, just stop and rest and pick it up the next day. If you aren't sure where to start, you know you want to start, work with a physical therapist. You can ask your physician to write you a referral for this, or a fitness professional who knows about your condition, to get some recommendations on exercise types, intensity, and how often you should do that. And if you're heat sensitive, so if the heat just tends to make you more tingly or a little more weak, give you headaches or anything like that, try some cooling products or activities that don't raise your core temperature as much. The recommendation here is swimming or Tai Chi. Maybe some light yoga exercises are good. I usually recommend you could freeze a water bottle and just keep that on hand in conjunction with regular water so you're able to stay hydrated. But that ice will gradually melt and you'll have nice cold wet water to keep your core cool. Also, there are some cooling vests available. You can buy them online, and that also works really well, or a cool towel. If you choose a swimming pool, just make sure that the pool isn't heated. You don't want the water to be too warm, or you might aggravate some of the MS symptoms. Diet. So what should I do about my diet? There's so many MS diets out there. There's not one specific one that has been shown through research to be particularly the best one. Although there's evidence that, just a more Mediterranean diet, so foods higher in lean meats, omega-3s such as fish, nuts, avocados, legumes or beans, that it seems to be the best for MS as far as reducing inflammation and promoting brain health. Although, there's a lot of other diets such as gluten-free, Paleolithic, Swank, Wales diets. So if those make you feel at your best, continue with those diets. Can't argue with that. But in general, the rule of thumb is just to eat a heart-healthy diet to optimize your overall health. So limiting sodium, sugar, processed foods, increasing your fruits and vegetable intake. We talked about lean meat, lean protein options. Soy is also a healthy option. Choosing healthy fats, so nuts, seeds, vegetable oils, olive oils, oily fish. Consume plenty of fiber, especially if you tend to struggle with constipation, and hydrate well. Vitamin D is an important vitamin, and if you haven't been checked for vitamin D deficiency, it would be a good idea just to ask either your neurologist or primary care provider about this. We know there is a relationship between vitamin D levels, MS development, and disease progression. There's just been some research as far as vitamin D deficiency long-term, and also populations where there is a higher percentage of individuals living with MS or diagnosed with MS are in Northern European areas, which tend to get less sunlight. So that's where that data comes into play. So it is important just to keep vitamin D levels up. If you have family members that you have, well, if you have had children and you're concerned about their overall well-being, genetically it is not too much of a concern, but making sure that their vitamin D levels are up to normal is would be recommended. We typically get vitamin D via sunlight and our diet, but we may need additional supplements, particularly if you're not out in the sun very often. If you live in a more hot area, I know in California we can have some pretty hot days, so individuals tend to avoid the sunlight. So if you're one of those, you may need to get vitamin D from other sources, such as supplements or your diet. Your vitamin D level can be checked with a simple blood test, so it's very easy to look at. Normal is between 30 and 100 nanograms per milliliter. And I can tell you it's very difficult to get up to normal. So if you're concerned about taking too much vitamin D, you're probably within that normal range. Your MS provider will help identify your personal goal and give you recommendations for supplement dosage. And there are over-the-counter dosages available, as well as prescription dosage that is 50,000 international units weekly. So there's lots of options for supplements. And foods high in vitamin D include oily fish, egg yolks, dairy products, juice, cereals that are fortified with vitamin D. So you can look at the label there. And sleep. Sleep is very important. People with MS are more likely to have sleep disorders in general, according to research. Some of those disorders are sleep apnea and restless leg syndrome. If you're unsure what restless leg syndrome is, I often describe it as kind of that feeling where you just have to move your legs. Particularly it happens in the evening time. I've also had some individuals describe it to me as bugs or ants crawling on their legs. So if you're concerned that you may have that, there is medication that can help. Impaired sleep can be a result of medications, MS symptoms, if you have a lot of pain, for instance, and or mood disorders such as depression or anxiety, things that are just rushing thoughts that are just keep playing over and over in your mind and you can't shut that off. Fatigue can be a warning sign of an underlying sleep disorder. So if you do have fatigue, your physician may ask around how you're sleeping. And talk to your healthcare provider if you have trouble falling or staying asleep or don't feel well rested during the day so that they can help you. There are several management techniques to help you get better sleep, including cognitive behavior therapy, adjusting medication regimens, improving symptoms, over-the-counter treatments, and other medications. There are also some natural sleep aids, too, that your healthcare provider may suggest if you prefer. So an overall summary and to oversimplify things, it is better to consume foods and beverages that enhance good health rather than those which impair it. And it is better to be physically fit than out of shape.
Okay. Thanks so much, Lindsay. So Lindsay just gave a rundown of a lot of physical symptoms, a lot of areas for wellness that you can start to look at your own life and see if there's aspects that you'd like to improve. Being a psychologist, I also just wanted to mention that depression and anxiety and cognitive difficulties are extremely common in people with MS. So it's important to be aware if you're having 2 weeks or more of feeling down or depressed or less interested in things that you usually enjoy, or if you're feeling anxious or worried on a daily basis, or if you're noticing, or your family members or people at work, friends, are noticing that you're not thinking as clearly as you used to. Those things are should all be brought to your primary care doctor or your neurologist. And there are known treatments that do work for all of these factors. So let's get into talking a little bit about, once you've identified what area you would like to work on, how you get motivated to start a goal, to identify a goal, to start that goal, and to keep that goal going. So people often ask how they can get motivated, particularly when change feels so difficult for most of us. The truth is that taking the first step to changing your behavior is often the trigger that starts the ball rolling for motivation. In other words, getting started begins this process. Most people want to wait until they feel motivated to start a new behavior, but actually research tells us the opposite, that behavior triggers more motivation. So what we want to do is, even if we don't feel like it, even if we don't want to, taking that first step might start to change those emotions and might make us actually feel more motivated. Additionally, many people try to set really big goals that are aspirational but really difficult to achieve. So one thing that I'll emphasize over and over in my part of this talk is that it's really important to take very small steps that are simple and achievable. In this way, you're laying the groundwork for a new habit and a new daily ritual. This is probably one of the most important pieces to staying motivated, is getting this new habit, this new goal, to be a regular, habitual part of your everyday life. So starting somewhere small can get that habit formed, and then you can increase that goal over time. Additionally, when you experience success with this small, manageable goal, you're also more likely to feel even more motivated and continue or increase that goal. If the bar is set too high initially, you might not succeed, or you may not hit that initial goal, feel frustrated, and end up giving up too early. So many people might have heard of SMART goals before, but I'm going to talk about this in a little bit more detail. A SMART goal is how you can refine your goal into something that's manageable and achievable. So earlier I asked you to talk about areas of strength, or write down areas of strength. Lindsay asked you to write down areas of wellness. And then I asked you also to write down an area that you'd like to change and the reasons behind that. So let's take that an even step further. SMART is an acronym that helps you formulate goals that are likely to get accomplished, thereby setting you up for success. Based on what you wrote down at the start of the session for both Lindsay and I, following the next couple of slides, I want you to try and refine your goal. Each goal should be something that's very specific. So an example of a non-specific goal is like, I would like to exercise. That's a really big goal, but it's very non-specific. So we want to get down into the nitty-gritty. What is the specific type of exercise that you want to do? Is it measurable? Can you tell that something is changing over time? How would you measure it if you wanted to measure it? Is it attainable? Are those barriers that you listed that we saw for Mitch, or that you wrote down for yourself earlier, are those barriers so big that they would stop you from achieving your goal? Or is the goal that you have something that you know that you could accomplish? Is it relevant to you? So I also mentioned earlier somebody whose doctor told him to stop smoking, and he had other goals that he wanted to work on first. He recognized that that was a really important goal, but it wasn't relevant to him in that moment, and he had other things that he wanted to start with first. So it's really important that the goal that you want to work for is relevant to you, and we want to put a time limit on it. So even if we want to start a new diet, or we want to start a new type of exercise, sometimes putting a time limit on it helps us feel like it's accomplishable. I'm going to start walking around the house for 1 month. right? We can try and start something new for 1 month. If we have to do it for the rest of our lives, that seems a little bit more daunting. We also want to think about triggers that can help us get off the couch or, get started. So are there internal triggers that help us identify that the goal needs to happen in that moment? If emotional health is something that you want to work on, then an internal trigger might be something like anxiety or depression or anger or those feelings that are inside of us. It may be a physical cue, if there is something like spasticity and you wanted to work on stretching, then when you're feeling particularly spastic, that's an internal feeling that nobody else can see. That might be a trigger for you that stretching at that moment would be a good idea. External triggers are things like a time of day or a time of the week, a class that's going on at your local gym or some other community location, maybe putting an alarm on your phone, somebody else triggering you to start that goal or to start that thing that you want to get done, or a specific location. So some examples of SMART goals that also use these triggers are things like for 1 month, so that we're putting that time limit on it, on Tuesdays and Thursdays, I'm going to do water aerobics for 30 minutes, right? Super specific. We can measure whether or not we show up on Tuesdays and Thursdays. It's relevant to this person. Like we said, it's time-based. When I feel stiff, that internal trigger, I'm going to stretch for 10 minutes. Super specific. We can measure whether we do it or not. Whenever I crave a candy bar, again, another internal trigger, I'm going to eat a piece of fruit instead. On Sundays, I will encourage my support partner to engage in his or her hobby for at least 1 hour. And when I stop at a red light, I'm going to do Kegel exercises. So for all of these are SMART goals that are specific, measurable, attainable, relevant, and time-based. So far, we've discussed taking that first step, making it very simple, keeping the initial change small and manageable to ensure success, and making the overall goal more specific using internal and external triggers, as well as using that SMART acronym. Once you've gotten started, though, how do you stay motivated? And that's probably one of the biggest barriers that a lot of people I work with is staying motivated. Many people can get going, right? And we see this a lot with the new year, right? That people start something, but then it falls off quickly. So staying motivated is something that I want to talk about next. So think back to those strengths that we saw in Mitch, or the strengths that you identified in yourself. How can you leverage these strengths to maintain your motivation? Do you have a cheerleading squad? Do you have family or friends who can help you stay accountable or provide you with praise and encouragement? Research shows that when people tell somebody else the goal that they want to accomplish, they're more likely to start and maintain that goal than if they keep it to themselves. Colleagues and healthcare providers can also be part of that group. When I work with people in psychotherapy settings, at the end of each of my therapy sessions, I end by asking that person to identify a goal that they want to work on until they see me again. And then the next time I see them, I start the session by saying, hey, how did that goal go? And this is one way that I help us stay on track, but I also help keep that person accountable to the goals that they set for themselves. I also want to identify again that we want to start small and we want the goals to be very manageable. In that last slide, the cartoon says, the person just drove by the store, and that's kind of a little bit tongue-in-cheek, but in some ways that's true. There's a researcher in California that talks about starting an exercise routine might mean that for the first week, all you do is put on your sneakers during the time that you plan to exercise. And that's starting that habit of exercising during that time that you've allotted for yourself. So start small and make sure each of the steps are manageable and that they will lead to success. More success breeds more motivation. Tracking progress over time can also be another huge motivator. We as humans in general are very bad at tracking things over time in our memories. Our memories are very fallible, and if you have cognitive problems on top of that, then it can be even more difficult. So if you can have an external tracking system, somewhere that you write down what your goal is and when you've accomplished it and how you've accomplished it, that can be a really huge motivator, especially when you see how far you've come at the end of that time base, so after the end of 1 month, for example. As you'll see in the next couple of slides, I think it's also very important to address barriers that are impeding any success to accomplishing your goal. And once you address those barriers, that may also help you maintain forward momentum. So the pause system is a way to take a step back and check in with yourself and determine whether this goal is the right goal for you or it needs to be modified based on some barriers that you might be coming against. So the pause system, again, helps us develop a strategy to track how you're doing, to recognize these barriers, and to keep pace with what's reasonable, as well as the true strategies that will help you stay motivated and maintain that goal that you want for yourself. Planning. I can't stress planning enough, right? We might want to just jump right in, but if you think about it, starting a new goal is really huge. If you want to try a new diet, that encompasses a lot of pieces. You may have to go to the grocery store and go down some different aisles and find the foods that you're not used to buying. Maybe it costs you a little bit more money. And so how are you going to fit this into your financial budget? If you want to start exercising, when are you going to exercise? If you have a lot going on in your life already, then how are you going to juggle the things that are already in your day and add in this extra time, right? So planning is really important because it's not just getting up and starting, it's really figuring out how you're going to fit this new goal into your life. Picture yourself being successful. What would that look like? Large plans produce a lot of anxiety and fear. Small, simple plans are safe, right? If you just put those shoes on, those sneakers on for a week, and you recognize, hey, I can't even do that during this time because that's when I normally am trying to get out of the house for whatever weekly engagement you have, then you'll know that trying to walk around the block during that time may not be successful. So starting small is a good step to kind of testing the waters and seeing if this is a reasonable plan for you. Account for the changes. So focus on things that are measurable. Be aware of and give yourself credit for the small changes that you do make and the successes that you do have. Again, like I said, track that progress, keep a written record, and share your progress with people that will continue to encourage you and to cheerlead your success. Figure out what the barriers are, and we'll talk about this in more detail in the next couple of slides. And maybe you might need to slow down your pace. Maybe things were going well for a while, and all of a sudden something in your life has changed, and that goal isn't going so well anymore. So maybe you need to slow down and start small again and build up again over time, and recognize that your progress may fluctuate over time, and that's okay. If you're having difficulty progressing, then maybe rethink whether this is the right goal and look at those areas of wellness and see if there's something else that you could fit in that would be more manageable. Focus on what you can control right now, today. It's really hard to predict what's going to happen sometimes a week from now, a year from now. So what can you accomplish today and give yourself credit for those accomplishments. And the final one is exercise your options. So you're the boss of choosing that goal and managing how you incorporate that goal into your everyday life. So having that choice also gives you power and control to change or modify the goal as your life changes and to kind of roll with any punches that come along. So let's look at barriers in a little bit more detail. Barriers can be a major factor that slow down your motivation. So things like timing or cost or distance. There was a person I talked to recently who really wanted to start going to ride horses, but the ranch that she chose was 45 minutes from her home, and she didn't feel comfortable driving that far. So the distance was a major barrier to her accomplishing that goal. So what is realistic? The difficulty of the goal. Is this something that's too big? Can we scale it back in some way? What if the people that you have in your life are not supportive of the goal that you've chosen? Is that going to be a barrier to stopping you or to slowing you down in accomplishing this goal? Are there family problems that are going on that are really disrupting your life and they're getting in the way of you being able to pick one of these goals? And is that something that you should focus your time on now? And if you're not getting any sort of reward for your success, that could also be a major barrier. Rewards are important. They help us stay motivated. Internal barriers are things like a lack of skill, a lack of confidence, energy, right? Fatigue is a major barrier for many people with MS. So if we pick something that requires a lot of energy, that could be a barrier to success. And motivation. There may be some, internal monologue that's going on in your brain that tells you that you're not going to be successful. So what is that internal voice telling you? Is that internal voice helping you, or is it keeping you back? Are you afraid of failure? What MS symptoms may be getting in the way of you accomplishing the goal that you set for yourself? Loneliness, depression, and again, like we talked about, that brain chatter or stress. So that internal voice can have a big impact on whether we are successful or not. So I want you to, with the things that we just talked about, as well as what Lindsay talked about and in the beginning, those strengths and barriers, I want you to revisit the SMART goal that you set for yourself. What are the potential barriers that might get in the way of you accomplishing that SMART goal? How do you think you could overcome those barriers? How will you track your progress? And who are you going to share your goals and your progress with? Who can you rely on? So I want you just to take a couple of minutes and see if you can jot down any of these things. What are the potential barriers that might stop you from accomplishing the goal that you've written down for yourself? What are some potential ways that you can work around those barriers? How are you going to track your progress? And who's going to be in your corner supporting you? Who are you going to share your goal with and your successes with? So I'm going to turn it back over to Lindsay and Laura, and we can do some questions and answers.
Great. Thank you so much, Megan. We did get a number of questions from the audience, and one question came up about communicating invisible symptoms to your friends and family. So Lindsay had talked about the invisible symptoms as well as the visible symptoms. But what would you consider a good strategy for communicating invisible symptoms that people experience with MS, Megan?
That's a really good question. Some of it depends on your friends and family member and how much they understand about MS and how much you want them to know. A lot of times what I recommend is, especially when people try to explain those invisible symptoms and maybe their family members don't seem as supportive as you think they should be, or maybe they really don't understand them, or I've had a few people who've even said things like, my family member just doesn't believe that these things are real. I really encourage you to bring that family member or friend with you to a doctor's appointment, or I encourage the patients that I see to bring their family or friend with them to a one-time visit with me, so that we can talk about what research shows and that these things are true symptoms and how they do impact individuals living with MS and specifically you. So that's one suggestion. It may also be helpful to look on the National MS Society's website or look for blog articles of other people with MS who have written about some of these symptoms and share these kinds of resources with a family or friend, just so that they have a better understanding that these are things that are kind of widespread, that many people are experiencing. Lindsay, do you have any other thoughts?
You know, Megan, I completely agree with you. And I often get this concern from my patients living with MS too, just that, oftentimes I think describing like those paresthesias, I just don't feel things the way you do. The fatigue, I think is a really common one where I just don't have the energy to do the laundry when I get home from work. And this can be a real struggle with other family members living within the same home to understand, mostly because they've felt tired before, but this is a different tired. So I completely agree with you, Megan, in that I often encourage those individuals to bring their spouse or their kids, or friends or extended family to come to the office visit, and we can talk about it together, or to look at different resources that this is common with multiple sclerosis and it's unique to that condition as far as the severity of the symptoms. So I completely agree with you, and that's exactly how I address that too, or what I usually suggest.
Great. Megan, we got a number of questions from the audience about disclosure. So people are looking for strategies on when and how to disclose their MS, either be it to their friends and family or their coworkers. Do you have any suggestions that you can share with the group?
If it's an employer or a colleague at work, that's a little bit more of a complicated question, because there are some employers who are very open and very willing to work with somebody that has MS. And I've also worked with people who have employers who have not reacted well to those kinds of disclosures. One resource that I really like to give people that are coming to me with this question is the Job Accommodation Network. You can just Google JAN or Job Accommodation Network. It's an entire website and individuals who have a lot of experience with disclosing information about a disability in the workplace. It's a completely free resource, so you can read the articles that they have on their website, or you can call. They have a chat box. There's a ton of different ways to get in contact with them. All of their resources are completely free. They even have lawyers that work there, so that you can discuss any legal ramifications of disclosing your MS. So Job Accommodation Network is what I usually recommend, is kind of checking in with them before you disclose anything to your employer. With family members, it's also a little bit different depending on the situation. Some family members are quite open, and maybe there's other families that are less open or don't understand symptoms quite as well. I think I might give the same type of advice as I just did previously, is that if you're not quite sure how to disclose and you feel comfortable with your physician or medical provider, maybe bringing that individual to a doctor's visit and having them help to describe it would be really helpful. Anything to add, Lindsay?
I'm grateful that you shared that resource. I think that's going to be very helpful for some people. And once again, I agree. It's a highly individualized decision to disclose your diagnosis to your employer and even family members. And I've seen the worst outcomes, and I've seen good outcomes. In general, I get a feel for how the way that I approach this with my own patients. I ask them, do you really want your employer to know, and for what reason? And if they really feel like they need to disclose it, then we talk about, just in what format. That would be just, a private office visit with their employer, having an outcome in mind, meaning, these are my limitations, and having an idea of how they can maybe modify their job duties to where they could still provide for the company as an employee. So that might be an option. If they really feel like they don't want their employer to know, I say, okay, let's keep that confidential. Anything that comes from me is going to be confidential. I just try to maintain the symptoms as much as we can so that they don't have to disclose it with their employer due to, just barriers that their symptoms may present as far as accomplishing their job duties. So that's usually my approach. And as far as family members, just kind of, everything you said, Megan, I agree with that. You really, it depends on who you trust, who you think is going to understand the diagnosis. And as a provider, I'm completely open to my patients bringing whoever they need to for educating about the condition. I've gone as far as showing MRI scans so that they can see what the lesions are and what's causing the disability. So, so that's absolutely an option.
Kind of continuing along the line of family members, one of our participants writes, my spouse will not attend group or visit the doctor with me. What can I do without tying him up or dragging him? I imagine that this is something that many people with MS experience. Do you have any suggestions, Megan, about what to do with someone who, doesn't want to participate?
Yes, it's actually pretty common. I have this come up a lot in my sessions. Many times I kind of talk over with the individuals, again, a little bit of what Lindsay was saying, what they want them to know, why they want them to know it, and what their ultimate goal is. So is it that they want increased support from that individual? Is it that they need more help around the house, or they just want them to be understanding? What's the ultimate goal there? And maybe kind of figuring out the underlying goal helps to figure out exactly what the best avenue is. Again, I think if your partner or your friend or family member is not interested in going to the doctor's office, maybe they're not even interested in reading resources that you pull for them from the MS Society, and maybe reading those resources for yourself and kind of knowing one or two facts and sharing those things in sort of small chunks over time may be helpful. But again, I think the number one thing that I would suggest is, what is the main goal that you're looking for, the outcome? What do you want from that other person? And trying to share that in a concrete way. Maybe that other person doesn't understand why it's so important to you. So is there something that you can share that in that respect that would be helpful?
Great. Thank you, Megan. Lindsay, we got a number of questions about relapses. Can you give a brief definition of what a relapse is and how to recognize a relapse versus another symptom?
Absolutely, and that's a very common question. So you will know that you're having an MS flare-up if it's brand new symptoms or symptom. It doesn't have to be more than one. So something that's brand new, you haven't had this before, and it lasts at least 24 hours. So that would be one full day. So 24 hours to roughly 5 days. That's a true MS flare-up. If you have, as far as MS symptoms, or we can call them pseudo flare-ups, that's another name for just worsening of MS symptoms. They're often triggered by something. So if you're extra stressed, if you haven't had enough sleep, even if you're hungry, if you've really, done a lot that day, if something like that happened, or you're ill or having a fever, or you're overheated, or even if you're too cold, and then your symptoms worsen for a few minutes or a few hours and then kind of subside as you, those triggering factors kind of normalize. Those are pseudo flare-ups or potentially worsening of symptoms. Usually they come and then they go. They don't really last for a long time, and they're not new. This is something you've had in the past.
Great, thank you for that. Just as an aside, we are going to have a special webinar on January 22nd, same time, 8 to 9:15 Eastern Time, and it's going to be on relapse and MS. So if you have more questions or would like more information on relapses, I would encourage you to tune into that webinar, which again is going to be on Tuesday, January 22nd. Keeping along the lines of sort of symptoms and symptom management, Lindsay, can you give a few techniques, just one or two, of recommendations about falling asleep and recommendations about staying asleep? We did get a number of questions about sleep.
Sure. Yes, and as talking about wellness, it's important that we do get our sleep. Let's see. One recommendation for falling asleep would be, making sure that you're in bed, lights are out, you haven't been on your cell phone or watching TV 30 minutes prior. If you're worrying about something, you have written that down, maybe in a journal or something of that nature. So that's one recommendation. Another is something that's soothing to you. Maybe that's like a warm, like chamomile tea. I know I've had some patients try melatonin or valerian root, and that's helped them to fall asleep. So those are some just a couple recommendations for falling asleep. As far as staying asleep, that one's a little bit tricky. You can practice some of those things I just mentioned as far as helping to fall back asleep. But if you're not consistently staying asleep, I would bring it up to your neurologist or your primary care doctor. And also kind of keeping in mind or trying to think of what woke you up in the first place. Are you having a lot of pain, burning sensation, tingling, a vibrating sensation, headaches? So is something to that nature waking you up in the middle of the night? Or are you taking a medication for fatigue and maybe that's potentially keeping you awake? So that's why I would encourage you to talk to your physician, whoever's treating you, about the fact of you not being able to stay asleep.
Great. Thank you, Lindsay. We often get age-related questions when talking about MS. So, Megan, I would like to ask you, the question that came in is, do emotional reactions to life events affect us more strongly as we age with MS?
So I'm going to speak in general terms based on what we know in the research. When we look at epidemiologic studies or sort of population-based studies of people who are aging with MS, what we actually find is that in general, people do better emotionally as they get older. So older individuals tend to be less depressed and less anxious than their younger counterparts. That doesn't mean that you as an individual may not be experiencing these symptoms and in a strong way. So if you are, it's always helpful to bring that up with your primary care doctor, your neurologist, or a mental health provider to assess them in more detail. But in general, research tells us that actually many times people with MS have better quality of life from a mental health perspective, less depression, less anxiety, and less stress as they get older.
Well, thank you very much, Megan and Lindsay. I think that we have discussed a lot of strategies for health awareness promotion for 2019. So I want to thank you for participating in tonight's webinar. I would also like to thank the audience for being a part of this interactive discussion. And I would like to inform you of some additional resources that you may find informative and helpful. On the Can Do MS website, cando-ms.org, you will find our archive webinars, our e-news, our library articles, and Can Do On Demand. You can also submit a question to the Ask the Can Do team, which will be answered by our team of MS experts. I would also like to talk about an initiative that you can find on our website called Kick MS. So if you want to share your stories and tell us how you kick MS, please go to our website, cando-ms.org/kickms. And another resource that we have available is from MS Path to Care. You can visit that at mspath2care.com, which is an initiative to empower people affected by MS to be active partners in their healthcare experience. The next webinar in our series will be on bowel and bladder issues and management in MS, and that's going to be on February 12th, 2019. Some of the resources available from the National MS Society is a variety of brochures and video segments that can be accessed on their website, nationalmssociety.org, and you can also reach their MS navigators to navigate the challenges of life with multiple sclerosis. I would like to remind you that you can register for the webinar series free of charge on the Can Do MS website, cando-ms.org. And for those participating tonight, you will see a survey appear on your computer screen. I would encourage you to take a moment to complete the survey and share your input. Your feedback helps us to continue to improve our webinar series. So I do want to thank you for joining us tonight and wish you a great evening. Thank you so much.